Hi everybody, today on the show we're going to recognize frontline workers and heroes that we have in our nation. We're going to interview 3 doctors and get inside perspective to the COVID-19 virus and see what's going on in their world. And we're all going to be wearing masks because we're authentically in the hospital. Join us in just a minute. We have Dr. Woodmansey, my husband, Dr. Snyder, and Dr. Costello. Stay tuned. Hi everybody, welcome to our show today. We have some very special guests with us. We have my husband, Dr. Ray Woodmansey, Dr. Tim Costello, and Dr. Eric Schneider. And today we're going to do a segment about frontline workers, and to me they're heroes, but my husband says they're more servants. But whichever way you want to call them, we know that they're doing a lot of great work in the emergency room. We're in Branson, Missouri. And they work in the emergency room here, and we're going to ask them questions and find out what they think about the virus and how their families are handling this. And I just thought it would be interesting for viewers to hear what what's going on in the ER and what their lives are like and what special things in their families have they had to do because of this. How did you get into emergency room? How did you get into medicine and sort of the steps that got you here?
Growing up, my mother was a nurse, so I was introduced to medicine early on. High school, I loved the sciences. The reason I went into medicine really was, growing up as a Christian, we were taught that really the basis of Christianity is servitude, and learning to be a servant. And I thought in medicine I would have a career where I could serve people, still provide, well for my family, and at the same time serve people. During residency, I was able to moonlight at some ERs around Wichita, Kansas, and learn to love emergency medicine. Really, I think it's the problem-solving aspect of medicine that I enjoy. A patient comes in, they could have 1,000 different things causing their symptoms, and you get to discover kind of really what's going on and hopefully help that patient. So after residency, started working in an emergency room in Neosho, Missouri, and ended up here in Branson about 10 years ago, 2010, and love it. Work with some of the best doctors in the world sitting here beside me.
Now tell me, would you say this is a calling?
Yeah, I think all Christians have a calling. Some are called to be preachers, evangelists. Some are called to be doctors, nurses, firemen, policemen. We all have a job to do. I think out of obedience, we hopefully early on in our life find out what that calling is and obey the calling, and then continue and listen to what God wants us to do and get it done.
Tim, what about you? Tell me. I know your journey is a lot different than Ray's. You were in the Navy. You can tell us a little bit of your journey of how you ended up in the emergency room.
My family is Catholic, and my parents were closely associated or affiliated with Catholic charities. So even as a young boy, starting when I was 3 years old, I was kind of personally involved with adoption of high-risk special needs children. So my parents were going out to find homes for the children that no one else wanted. And so different races, different countries of origin. You have a sister that was from Korea, a brother that was from Mexico, African-American brother whose mother was on crack cocaine that I helped raise from when I was 12 years old. So I knew that there was something that I wanted to do to help other people, and that was kind of what our church teachings were. But I wasn't really sure what exactly I wanted to do. Initially started out with psychology as a major, and that was what I majored in at college. And I thought, well, I'll do that, or I'll be the team trainer for the Baltimore Orioles, my favorite baseball team at that point. Never really knew that I would be going into medicine. I didn't have any family members in the medical field. Kind of first person in my family to ever be a doctor in our entire family tree. And so what happened was I was a sophomore in college, and the trainer that I was volunteering with said, "Hey, your grades are really good. Did you ever think about going to medical school?" No, because I didn't have anybody point me in that direction. So at that point on, something clicked, and I just started way behind the eight ball, so to speak, as far as the process goes. But and started that process. Went back home after college. Worked as an alcohol and drug counselor while trying to get my medical college admission testing, or MCAT test, done. Applied, was a little bit of a one-off, and then I joined the Navy in order to pay for it, because my family was always very, I wouldn't say poor, but we had very tight resources. Kind of blue collar. My dad's a factory worker, worked in the same plant for 40 years. So I joined the Navy, did what's called a health profession scholarship program, and then after medical school, then went and served as a intern in Portsmouth at the Naval Hospital there. Then got accepted into the flight surgery program in Pensacola, and then from there I went to Jacksonville, Florida, where I was stationed, and then almost immediately deployed to Iraq in support of Operation Iraqi Freedom. And there I did medevac in support of the war. One of the things I would say that led me to emergency medicine was that during med school, I said, I like everything. There's so many different things that are all interesting. I like it all. I like learning about all that stuff. And the field where I felt like I got to do more stuff than others was ER. It's kind of the jack of all trades, master of none, but it was still, it involved me in enough different areas of medicine. I thought, this is something I think I'm called to do. Like Ray was saying, I do feel it's a calling. It can be tough. It can be a grind. But I really try and treat each patient as if they're a family member. I continually try to remind myself, it might be me or it might be my family member on the other side, in the bed as a patient. How would I want them to be treated? And so that's what, kind of gives me fulfillment, is being able to treat others well, with respect, and to treat their disease process or make them better. So that kind of what drives me to continue to do what I'm doing now.
Eric, we're glad you made it. Eric just actually came right from the ER. We're glad you came, and we'd like to hear your stories, different even from theirs, of how you ended up in the emergency room. So tell us your journey, Eric. How did you get here?
Well, initially I had no interest in doing medicine. In fact, I was quite adamantly against it. My family was, both my parents were involved in the mission field. So my mother's father was a pastor, and she grew up in India, and they worked in India for over 30 years. My father's dad and mom, he was a surgeon in Rwanda, so he started just a little rural clinic in Rwanda and turned it into probably one of the best hospitals in that region of Africa. And so he built that up over 30 years. And I saw the cost that was involved, and it took a heavy burden on him and his family. He'd be up at surgery in the middle of the night and frequently exhausted and worn out and beaten down by it. And so it was not without sacrifice. He loved it, and loved it until the day he died. It was his passion. And his wife supported him and served, and I watched all that, but I wasn't sure it was for me. And even the idea of medicine was a little bit daunting to me. Just didn't sit well with my stomach initially. But as I went to college, I was a physics major and chemistry major. I realized that I probably wasn't smart enough to thrive and think in a mathematical way that you need with that type of mathematical intelligence. I also realized in doing it, even though it was fascinating to think about and academically, the actual outworkings of it, I wasn't interacting with people the way I wanted to. And I really craved just really being able to see into people's lives and know who they were, understand who they were. And similar to Ray and Tim, that calling of serving others, and that was the central value of my family growing up, and of my parents as well. I grew up some in Rwanda, some in Kenya. I was seeing India, I visited India, and I was terrified that one day I'd be called to be a missionary doctor in India. That was like my worst case scenario. So anyways, through college, I really wasn't pursuing medicine. It was the furthest thing from what I would want to do. I applied to multiple physics and chemistry externships. I pursued, all the type of support of training that I would need to go into physics and succeed. I kept running into roadblocks. I showed up at University of Nebraska for a physics internship, and I ended up being assigned to a biochemical lab instead of to physics. I did another externship my next summer, and instead of ending up in the physics department, they placed me in another biochemical lab doing medical research at WashU University in their research labs. So it was very interesting. You've heard like the footprints in the sand type story. I mean, this doesn't exactly apply, but that idea of looking back and seeing how God has been leading. So when I reached trying to decide which direction to go, my uncle, who was a physician who was working in Rwanda as well at the time, had challenged me just to consider it, just to think about it, to take the MCAT. And I did take it, and he's like, what do you have to lose? If you fail it, then you're out. So I did fine. I did great on it, and then the same thing. He's like, well, just apply to medical school and see what happens. And so I applied to medical school, and looking back, I realized that all these directions I'd pursued, God had really laid out almost perfectly for what I needed. For instance, in the one biochemistry lab, I had to do tons of reading to help with their research project, and that was all that what prepared me for the MCAT. And I realized that basically what I was doing every day was the same thing I ended up doing on the MCAT when I took that. And so God had prepared me for that test to do well. He'd given me the abilities to do that, and he closed some doors the other direction. And so, somewhat reluctantly, and then I got a scholarship for the first year of medical school for free, and I thought, well, it'll be a cool story. I guess I'll give it a try. And after trying the first year, it was actually fascinating. And I realized the first year is all didactics, it's all in the classroom. I realized I haven't gotten anybody's life yet. I don't even really know what medicine really is about. And got deeper and deeper into it, and I absolutely love it. Like Tim and Ray know very well, it can have immense challenges, and as I knew, from my fears watching my family who has done medicine, it can have a lot of challenges and require sacrifice. But loving people demands sacrifice and takes hard work, and I was willing to do that, and it's also had great rewards, as following Christ does. When we follow his calling, it does take great effort and sacrifice, but he also blesses us immensely. And so I've been able to be blessed by being able to go into medicine.
Every one of you have such a unique story, but what I'm hearing from all of you is it is a calling. God did direct you, and because of his direction, his hand upon your life, you're reaching many people, which brings me to the current situation, reaching people in the emergency room. I mean, right now, when this came about, the COVID-19 virus, how did you react to that? What was your reaction, and how did you feel at the beginning?
I think initially curiosity more than anything, just thinking, could this be the big one? You read about and see movies about pandemics that wipe out, half the population and stuff. So I was on the internet, where I get most of my medical information.
That's a joke.
Researching and seeing it every day, how many people were infected and how many people were dying, and thinking, this is going to get to us. What do we need to do to prepare? So luckily, we have some smart people in our administration here that really got the hospital ready for what could be coming. Luckily, we really haven't seen a wave. We've seen a few cases here in Branson. I think in Taney County, we're still sitting at 12 positive cases and 2 deaths, which is nothing compared to what they've seen in New York City and New Jersey. But we're still, we know every patient that comes through the doors potentially may have COVID-19. So we try to be vigilant and treat every patient that comes in as a possible case. And you and I are opposite in a lot of ways. How personal can I get on this thing?
You can be personal.
So
Go ahead.
I'm the opposite of a germphobe. As she can tell you, I'm the kind of guy that thinks, the stronger your immune system, the more healthy you are. So picking up food off the floor and eating it, that's helping your immune system. When this first came out, this is a new virus. This is novel. This is something none of us have immunity to. So Marla, being more of the germ phobe, where I'm just the opposite, was like, okay, we're going to have to sleep in separate bedrooms. As soon as you get home, you've got to wash your hands. I won't touch your laundry. You got to do your own laundry, et cetera, which is still kind of continued today. But in the emergency room, besides having to wear a mask all the time, which is kind of a pain, and then, being vigilant all the time with, since a patient could be totally asymptomatic and have the virus, a patient can come in with an ankle sprain and they can still be positive for COVID. So you have to, keep your eyes open and be looking out for it all the time.
Thank you for sharing. How about you, Tim? I know it's challenging. It's a whole different work environment. How is this affecting you?
I think initially, one of my main concerns was, are people taking it seriously enough? Because I was, closely monitoring the data that was coming out of China. You had the initial, I think it was an ophthalmologist who kind of, for some reason or other, said, hey, this is not normal, this isn't right. And then he was sanctioned by the state, and then oopsie, at the end, they're like, yeah, our bad, he was right, this is something real. My concern was, are people taking this seriously? Are we saying, oh, it's only people that went to China that are going to potentially be exposed, or is it already here, which was my concern. And so I think the initial response for me was hypervigilance, trying to get as much information as possible, going out and buying ponchos and, buying other things that we could have available in case we needed it if we ran out of supplies, which would be a concern. And in addition to that, it was kind of just making sure I had my own personal gear. So I went and bought a respirator off the shelf at Home Depot, and I got one for Ray too, saying, hey, look, we just want to be prepared. And so I think that kind of waned a little bit as time went on, as we got to see that, hey, it's right now, it's not as bad as New York, and we don't have this, but we still obviously need to take it seriously. So I still try and be vigilant. I think I've been able to relax a little bit and say, hey, look, here's what we need to do to be safe. We're finding out more information, and pretty much every day as we go along, we get more information on what's going on, better ways to deal with it, and to help others. So I think I went from one extreme to more of a middle view of, hey, it's real, it's here, it's not as bad, at least locally, as we thought, and then kind of proceed along the next steps to keep ourselves and our patients safe.
So at home, like we talked about how we separated our bed sleeping for a while, was so concerned that Ray was going to carry the germs home. Did you and Sonia do anything like that, you and your wife or your children?
I offered.
I was between actually 2 germ phobes, just to let you know.
So I actually offered, and I said, well, I'll just move downstairs.
3, actually.
And she said, no, so we're in this together. If you get it, I'll just, I'll more than likely get it anyway. So why separate out? I did take care of. I think I had the first positive case that we had here. And after that, I'm like, well, I'm not sure. And then the next day or two, I started not to feel well, and I just wasn't sure. So at that point, then I got quarantined downstairs in the basement. I remember sitting on the landing in the basement steps. There was like a landing in the middle, and Sonia had a gate up, and I sat at the middle. And I could wave hi to her and the kids. And boy, after a couple of days of that, I started feeling pretty sad. I'm like, is this how it's going to be the rest of the time, or what? But I got better within 2 to 3 days, and never found out what it was, but never had any other symptoms. And since then, I do try and be courteous. I leave my shoes in my truck. I go right to the washing machine when I get home and put my own scrubs in there. And then we have a lot of hand sanitizer, and I wash hands. And then what we started doing is we wear masks when we go in public, if nothing else, to be courteous towards those that are more susceptible, right? So it's a little bit of an inconvenience for me, but it could be life-saving for someone else. So that's the way I look at it, rather than it's my right to not have to wear a mask. I say, hey, look, it's just feels like it's the right thing to do. I'm protecting maybe my family member, maybe somebody else wears a mask and protects my aunt who's on hospice, or protects my mother who's elderly, those kinds of things. So I just try and set the example that way. And I do the same thing at home. And so my kids wear masks. We started letting them play again this week with friends, and we just ask that they wash their hands and try and be as clean as possible. It's about all you can do at this point.
I love that you pointed that out, because that's really how we should view this, as being unselfish and kind to others. And I think that's very important right now in our society, to think of it that way.
Sure.
Eric, what about you? How did you feel about the virus when it came? How did you respond, and what kind of things went on at home?
Well, the unknown is always scary, and there was a lot unknown at the beginning. I'd get a lot of phone calls and texts from different organizations and churches and asking, what should we do, and different people and people running businesses. And so initially the concern was, of course, similar to what happened in Italy. We were fearful, especially we have a more elderly population here locally, and we didn't want to get in the position where we had to ration care, which was even being done in Italy, which would be, you have a 16-year-old come in who needs a ventilator, and you have a 60-year-old who needs a ventilator, and you have no more ventilators. Do you pull someone off a ventilator and let them die to save this person? And so we were seeing that overseas in some areas, and we didn't want that to happen here. So my first concern was to slow it down as much as possible in the community and within our own staff as well, because we didn't know if multiple staff members got it. Not only could we be overwhelmed with more patients, but we also could have a reduced staff because they were ill. And so just the practicalities of that, the hospital did a phenomenal job preparing and getting ready for it as much as they could in an environment where there wasn't enough masks across the nation. And we did deal with a lot of shortages for a while and difficult decisions of how to ration personal protective equipment, masks, things like that, and what would make sense, even though it wasn't the perfect world that we're used to in America, where everybody has plenty of what they need. It felt a little bit more like in Rwanda, where you kind of have to deal with what you have sometimes, and I hadn't felt that in the U.S. before to that degree. I'm going to say William Mahoney and Lynn Yagi and Sean Ussery, who are kind of our administrative leadership here locally, as well as from Springfield, were extremely supportive, made very wise decisions in preparing, and so we are and we're ready for as much as we could handle, and far more than we could have handled before they started getting things ready. So if it would have hit day one, we would not have been to that degree. We've had the benefit of learning from other parts of the country, and we've been very fortunate to not have a rapid influx of cases as has been in other places. And across the nation, even though our country financially has suffered from that, I think it also has avoided a lot of suffering, both financially and physically for people in the end. What leads next, we don't know. So tomorrow we could have a massive surge of cases here. One of the problems with a virus is its exponential growth. So if one person has it, they expose maybe 2 or 3, and then 2 or 3 expose, 6 to 9, and then, it can go on from there, and you could even expose more people more rapidly depending on the setting. And so you have the potential for this rapid expansion of the disease at any time. So we're constantly vigilant to that. I was just thinking today, it's very difficult. I miss my patients. I feel like we're all hiding behind masks. I don't get to get as close to them. I feel like there's like a constant barrier. Mm-hmm. And so I was just thinking today, as I was talking to family members about some life and death decisions, and you're trying to talk through a mask with goggles on, and your goggles are all fogged up, and you're trying to interact with somebody else who has a mask on, and it certainly has made it more difficult. And I wish I've found I normally daydream about being out in the woods and getting out away from people, because when you're at work you're inundated with people all the time. I found myself having thoughts of craving Silver Dollar City or going to the fair and having crowds of people around me, and I've never had thoughts like that before. So it's certainly a little bit of isolation, even working in the emergency room. At home, my wife and family have been wonderful. Initially we didn't know what degree of protection and caution to take. We were very cautious, but we knew this was going to be kind of a long haul. This was going to be over months, and so even though we thought ideally we would remain separate, we knew we couldn't do that for that many months, and that we would rather take the risk of being together and facing that together. Unfortunately, my family's healthy, and I can make that decision. If the prevalence here locally changes, though, we all may be back sleeping in different rooms. So if we do have an explosion of cases here locally, that will very much change that equation. And I think we'll have to all make some choices of whether to stay more separate or not, depending on how much we've been exposed at work. So at this point, we've been fortunate enough we haven't had very many cases, and so haven't had to do that. But I think for all of us, that would could change quickly.
I asked the Lord before we came here today, I said, God, what is something that you would want me to talk about that kind of ties this up? And I felt like Ephesians 2:10 kind of sums it up. It says, for we are his workmanship, created in Christ Jesus for good works, which God prepared beforehand that we should walk in them. And so we're just very grateful that you all are walking in your purpose, and you're his workmanship, and you're doing exactly what God has called you to do. So we're very grateful, everyone listening. I know Ray doesn't like me to say that you're heroes, but to a lot of us you are, because you're using the talents and gifts God has given you to help somebody. And technically that's a hero. And really, everyone listening, we can all be a hero, whether you're a mom at home with your children, or if you're a nurse, or you're a teacher, or a fireman, or whatever God has us to do in whatever capacity. If we do it as unto him, and we're his workmen, and we're fulfilling the purpose he has in our life, then really we're a hero to somebody. But I appreciate you all being a hero to all of us who needs medical care. So thank you from the bottom of our hearts. We appreciate it. We just want to thank all the heroes out there. Thank you for all that you do. We're very grateful. And remember, with God, all things are possible. Here at Dr. Marla Ministries, we are committed to you. We want to empower you and encourage you with God's Word. If this ministry has helped you, we'd like to ask you to help us take God's Word around the world. We'd like you to become a partner with us. We want to partner with you. It's about meeting your needs and helping you. If you'd like to help us, you can contribute and donate on my website. You can go to drmarla.org, go to giving, or you can call 417-598-2577. We just are led of the Lord, and we do exactly what God leads us to do, whatever nudge he tells us to do. I've done things in Africa and helped the people there and helped meet their needs, some of the people that needed a church. And recently with the COVID-19, we were able to feed some people, some widows in our neighborhood. We're just about helping people in this ministry. And whatever we can do to help you, that's what we want to do. So would you consider being a partner with us today? Because we are here to partner with you. Remember, with God, all things are possible in your life.